Good morning, good morning. What's on my mind? I'm Dr. Dale Dangleben, and on behalf of Patient Choice and Sheeman F. Point, Michelle, this is your daily medical tidbit. I spoke about breast cancer, ovarian cancer, prostate cancer. I want to talk about the top 10 cancers in the Black population, and then next week I will go back into individuals, right? I talked about prostate. Prostate is the number one, it's the most frequently diagnosed cancer among Black men. Okay, so we talked about this yesterday, and all the things as it relates to prostate cancer, and I just want you to, think about it, the screening, the PSA, and think the digital rectal exam, okay? I also talked about the second cancer overall, breast cancer. It is the most common cancer in Black women and the second leading cause of cancer death, all right? And I talked about the disparity in all of these, right? Black women face a 40% higher mortality than whites, okay? So again, and there's different forms of breast cancer. Your doctors need to explain that to you, all right? Especially the ones found more frequently in younger Black women, especially the ones that lack estrogen, progesterone, and the HER2 receptors, so that the treatment becomes a little more challenging, right? So we have to talk about socioeconomic inequities when we talk about, cancer and mortality. All right. We talked about breast cancer. I will circle back in terms of certain signs and symptoms at some point in another lecture. Colorectal, number 3, colorectal. It ranks among the top 3 cancers in both Black men and women. Okay? Blacks have the highest incidence and mortality rates of colon cancer in the United States. All right? And more likely to be diagnosed before the age of 50. Right? So remember that. There's a lot of association in terms of, poor diet, or high in red meat, processed meats, obesity, low fiber, and a lot of other things that relates to colon cancer. All right. So if you have rectal bleeding, you have low blood count, which is anemia, vague abdominal pain, changes in your bowel habits, screening must be done. All right. Preferably a colonoscopy, and talk about getting scoped at a much younger age than previously proposed. Okay. Number 4 is lung cancer. It's the leading cause of cancer death among Black men and the second in Black women. All right. Tobacco use, obviously, and that's important, to know. Again, the metabolism of nicotine, environmental exposures, right, is all important to know. We'll go into more detail into these individual malignancies at some later date. Number 5, cervical cancer. Cervical cancer rates are twice as high among Black women compared to white women, right? And that has to do with disparities in Pap screening, timely treatment, and also HPV vaccination. And when you hear the vaccination word, everybody pulls back, right? But remember, the human papillomavirus is the main cause of cervical cancer, all right? And because of this mistrust of the medical system and cultural barriers, you have delay in diagnosis. I'll touch a little more about that, next week in terms of the presentation and how it can be managed. Number 6 is a liver cancer called hepatocellular carcinoma. That is a primary liver of cancer of the liver, all right? And it usually comes from chronic alcohol use, chronic hepatitis B or C infection, and also from what's called NASH or NAFLD, non-alcoholic fatty liver disease, all right? And there's a lot that goes with that also that you can read up on. The 7th is pancreatic cancer. It has one of the worst survival rates, all right? and occurs more frequently in blacks. Also, it is diagnosed late because the symptoms appear late, right? And the treatment in of itself is really aggressive surgery, which carries its own morbidity and mortality. But genetic mutations, chronic pancreatitis, smoking, diabetes, obesity, all these things are risk factors. Okay, I'll go a little more into that at a subsequent lecture. Number 8 is kidney cancer, renal cell cancer. Okay, twice as common in blacks as in whites. All right, hypertension, obesity. There are certain genetic variants. I will touch on that some other time also, but again, access is important. Equal access to imaging, to the nephrologist, right, to the surgical oncologist. All these things are important. Number 9 is stomach cancer. Stomach cancer occurs twice as often in black people compared to whites. Risk factor, the Helicobacter pylori, H. pylori infection. Your diet high in smoked or salted foods, pay attention to that, right? I love my smoked meat and broth, but you can't do that too often. Low intake of fruits and vegetables, right? And again, genetic markers are always involved. I will do a presentation specifically on gastric cancer at some point. And number 10, I've spoken about before, is multiple myeloma. You can go back and see that lecture that I gave on that. So these are the top 10 malignancies in black people. We continue to educate each other, and I think it's important. I will touch on some of these individual topics next week. Have a great day.